So my name's Emily Jones and I'm a Senior Professional Clinician at Massey University. And I'm now the Expert Advisor for Paediatric Feeding and Swallowing for NZSTA.
Great, and thanks for coming to talk to us about some of the work you've been doing clinically. I hear that you've been getting some media attention with some of this work, so it's great for NZSTA members to hear a little bit more about it.
Yeah, so we were approached by, it's going to be I think on the Sunday program, and it's around the work we're doing with children who have avoidant restrictive food intake disorder. And so we have a clinic called Activating, which stands for Advancing Children Therapeutically in Variety Eating. And we're a multidisciplinary team. We have dietitians, speech language therapists, and we also have outside help from psychology and occupational therapy.
And what sort of kiddies come your way?
We have a bit of a mix. So the youngest I've had has been 15 months and the oldest I've had is 13. And we do, so depending on their age, depending on how they're presenting, we will do either a program of systematic desensitisation, which is just, again, these kids are very afraid of food. They're very afraid of different textures, smells. They have often a limited diet. They probably would have less than 15 foods in their repertoire. And what we need to do is really move them past 30, because that's what's kind of in the literature of what children should have as core foods. So it can be around, they might be missing whole food groups, so they could be missing proteins. Generally, when I look at the kids I've had that have difficulty with raw, unprocessed fruit and vegetables and meats, so often I'm finding that they really have a real, they have immature feeding skills and often chewing skills. So as speech and language therapists, you know, that's something that we can really focus on. So I guess with the students, look, we'll have these groups. Sometimes we have children who have real sensory issues with foods. You know, for them, touching food, smelling, they have very increased sensation, and that could be due to them having sensory processing disorder. They also might have maybe autism spectrum disorder, other things going on as well. And often I really need the help of an occupational therapist there. And
sounds like there's obviously a real need for a speech language therapist in the team.
Definitely, and I think the oral motor side is something that, yeah, even the oral motor sensory side is something I'm really keen to explore more, because I'm really finding, and often some of the assessments we use just aren't subtle enough often to pick up.
What advice would you give members if they're struggling with some of the kiddies that they're working with in this sort of area?
Look, it's really hard for clinicians out there. Look, in terms of our public service, you know, this is a very specialised area at the moment. I know, you know, a lot of people contact me because they're struggling. It's something that they can't do as part of their scope of work, in maybe if they're part of the ministry, and even if you're in the district health boards, you know, there's a very strict criteria for clinicians. So, look, I would say, if you're worried, look, we're really happy to help. We're happy to give advice, something that you can pass on to parents, and look, you can always refer to us. Sometimes we really invite people to come and watch what we do if there's something that they can do to their practice. But it is a challenge for clinicians out there, and I'm just hoping that, you know, through the work we do, it's really going to try and advocate for these children who's, you know, they are, you know, I think what we're looking at now is, it's very interesting, some of the more nutrition research is coming out. We're seeing there's actually going to be some long-term difficulties with these kids if we're not addressing this early on. So it's actually looking at real prevention work, because we're seeing some of these children can actually be those children who become obese. Even though their growth's okay, they're having such limited diets, maybe very carb heavy, very nutrient dense food, that actually really affects their health later on. So there's a lot that we can do as SLTs, and especially a lot around giving them skills to take on harder to chew foods that are age appropriate. But it's actually about doing exposure, working with the age of that child to kind of increase that enthusiasm or in that motivation to engage with that, and break it down so that you're moving in really slow steps, and helping the parents with that too.
If a therapist was starting to work in this area, can you advise them on how many sessions they should be imagining it might take to move a child on?
Yeah, well, a lot of some programs out there that they've overseas, they talk a lot about 12 weeks, and they talk about it being intense. So sometimes I agree too. I think intense work is often good. It gives children time to consolidate. I'm a big believer that you need to try, and the things you're doing is that they need to take these strategies on for themselves. So I think if you can do something intense, if possible, even if that's maybe twice a week or weekly, I think that's with a gap in between. I think that's a really nice way of working.
Thank you. Thanks for sharing a few of your tips and for advocating for speech language therapy for these children. And we look forward to hearing more about your work as you continue.
Thank you.